Well, good evening this evening. I really appreciate everybody turning out. This is a wonderful project. It truly is a partnership with Warren Schools and Jane Pauley and the East Side community that we have been working on for quite some time now, but it's the inspiration of so many people and the commitment that made this possible. I'd be remiss if I didn't at least recognize some of the people within the community family that have had a major role of this, that have lived this over the past several months. So I'm going to name a few, and I know I'm going to leave some out, so I apologize in advance. But Mr. Bill Kingston, Mr. Dan Hodgkins, Doctors Robin and Tom Ledger, George Geiger, Anita and Amelia and the whole foundation staff, Doctors Hobbs, Bertia, and Kraus, our CPI leadership, Teresa Campbell and Jim Butler. And I know there's many, many more. But these are people that inspire me and others every day by your passion, your commitment, and your leadership to do the right thing, for the people on this side of town and help us deliver care. Thank you so much. I had a set of comments that I was planning on talking about tonight, and then I went and listened to Jane today, and she spoiled the whole evening for me. I thought about what she said. It changed everything that I had reflected on about what this is all about. What she did is she connected the community, the East Side community, and its passion for healthcare in the 1950s, which I wasn't here, but from what I understand, with that in 2009, 10, and going forward. And what do I mean by that? She said two words. She said neighborhood and renaissance. And you're right, I couldn't spell renaissance, nor could I even find it in the dictionary for a while, but I got them finally. Neighborhood, according to the dictionary, it's a community of fellow men, a community of fellow men. And if you think back to the 50s, for those that understand the story, a group of citizens, neighborhoods, churches, schools, business people, community organizations decided that we needed health care on the east side of town. They raised money. They built a hospital. That's why it's named Community. They built the Community East Hospital, and they charged that hospital with a mission that says that our primary purpose was to take care of the citizens on the east side of Indianapolis. And that's what this is all about. So then we get to Renaissance. What does Renaissance mean? A rebirth. It's a rebirth. And to me, this is a rebirth, not necessarily of the facility, but of the passion. It's of the spirit. It's a rebirth of our obligation to bring affordable, quality, dependable health care to the citizens of the East Side. The model's different. I understand that. There's still a need for hospitals, but the partnerships that we're able to put together with people like Warren Schools and the area businesses and the schools and churches and business people and community organizations, it's the same. So from my perspective, what this is that the Jane Pauley Community Health Center, it's a renaissance of healthcare on the east side of Indianapolis. It is a rebirth of our passion, and that's what we're all about, and that's what we're committed to do. Years ago, a lady named Margaret Mead once said, "Never believe that a few caring people can't change the world, for indeed, that's all whoever has." I think that says it so well of what this is all about. And I'd like to thank Jane for your lending us your name, your reputation, and your commitment to quality in everything you do. But more importantly, I'd like to thank you for your commitment to your neighborhood. Thank you.